Now, there was one very controversial story that had a short shelf life today, we hope. It relates to the possible decriminalisation of drugs in our most populous state. In this front page story in the Daily Telegraph, Anna Caldwell revealed how the New South Wales Cabinet considered a proposal to reduce the consequences for people caught in possession of illicit drugs like ice or speed or other pills. The idea is you'd have to have a warning system, say 4 strikes, before you'd face criminal proceedings. Reportedly, this idea had a lot of support in Cabinet, apparently because it might free up the courts. Really? If you want to free up the courts, you could decriminalise housebreaking too, or car stealing. It's a pretty silly logic to exercise here, isn't it? Thankfully, some senior ministers arced up about this, including the Nationals leader and Deputy Premier John Barilaro on Ben Fordham's breakfast show on 2GB this morning.
I can promise you this, we're not going soft on crime. We'll continue to make sure when it comes to drug dealers in this state that they get the maximum penalty thrown at them. And, you know, I know what that looks like. And then the last thing I would want to see is a softening on anything to do with drugs in this state.
And the message has certainly gotten through. Here's the New South Wales Premier a few hours later.
Can I make the position very, very clear? We will not be decriminalising drugs in New South Wales, and I can't be clearer than that. I don't support it. My government will be not going down that path, and I can't be clearer than that.
So that's that for now. Be careful. There are plenty of people inside Parliament and outside of it who want to go down this dangerous path. I'd love to know what drugs they're on. Let's bring in the New South Wales Health Minister, Brad Hazzard, now from the Sydney CBD. Thanks for joining us, Minister. First up on this issue, were you opposed to this drugs plan?
Chris, I've been a minister for 10 years and I swore an oath that I would not discuss discussions in Cabinet. But what I can say is you've heard the Premier, what her view is. What I can say to you is if you're interested in my views more broadly rather than this Cabinet discussion at the moment, last year and the year before, you'd remember we had a really tough time here in New South Wales with young people using ecstasy or MDMA at music festivals, and I made very clear then that I didn't support pill testing and didn't support the legalisation of that use of MDMA. But as to Cabinet, I'll stick with my oath and I'll leave it to the Premier, who's entitled to make the commentary for the government, which she's made very clear. She made it very clear today that there would be no decriminalisation. So I'd rather leave it at that. Let the people who want to talk about it, but I'm sticking with my obligation as a minister.
There's going to be pressure on this issue for years, months, decades to come probably. You'd be all very well aware of that as a health minister. You mentioned the pill testing issue. Apparently Attorney General Mark McGowan was keen for some reform of the laws here, and there are people in the medical and welfare and legal circles always pushing to soften drug laws. You're saying you'll withstand that pressure forever and a day?
I'm actually saying what I said, that is that when I needed to make comment publicly but not as part of the Cabinet process, I made my views clear on, for example, ecstasy. So I will not be commenting on the Cabinet process. I actually find, you know, part of the issue for a Cabinet Minister is when you're sworn in, you actually swear an oath to the community and to your Queen, and to generally what you're saying is you will behave in a way that reflects what is expected of Cabinet Ministers in the Westminster system, and that is let your views be known very clearly inside the Cabinet and then let your leader or the appropriate minister make the statement at the appropriate time. We have 24 people in our Cabinet in New South Wales, and there is a range of views, I have to say, on every issue, which is great because it reflects the community. But mostly I'd say our government, well, that's why we were re-elected again, does come up with the right decisions, and I'm hopeful that in the fullness of time we'll come up with the right decisions on that one too.
Obviously a bit of leaking going on at the moment though, which is always a worry.
I've been around for a long while, Chris. You and I have both seen that for many years, and actually you guys love it. I'm not a proponent of it, and I'm not a participant in it, and I won't do it.
Not me, I'm not into it, but there you go. Look, let's get back to the issue at hand when it comes to health, and that is the one case. Is there any update on that? You've been doing contact tracing, of course, of close associates. Some of the family members and friends have gone into isolation. But any update on the number of infections at this stage?
There's no more at this point. you've got to remember, Chris, that this one came up. We have our cut-off time in New South Wales for each day at 8 p.m. And last night we reached the 26th day at 8 p.m. with zero community transmission. I think I got a phone call at about probably 10 o'clock, give or take, to say that it looked like there was now a positive case. And then I got a much well-received and I was very grateful for it, an email at 1:22 a.m, which I read at that stage, indicating that they were doing, our health tracing teams were out working on it, and they were working with the transport people, because we have a provision where we can cross-compare data, so we're able to look at the cards that are available in every state. But
sorry to interrupt,
so
but you'll be expecting more cases here, though, but you wouldn't be particularly alarmed because you know where the infection came from, you know who's got it. Surely you'll be on top of any outbreak here, and Western Australia is overreacting by talking about the possibility of delaying their border opening.
Actually, in terms of knowing the source, the likely sources are still open, because it could either be the hotel quarantine. This lady worked in one of the police-managed quarantine hotels, doing, I think, domestic type work. She also worked in another hotel. They're both located down almost next to each other at Darling Harbour in Sydney. But last night they commenced the what's called genomic sequencing, so looking at the genes to see where this infection has come from, where this virus has come from. And they're doing all of the what's called tracing. They've had numerous discussions with this lady and some of her family members. The people in her family were all tested as well, which is a very good sign, because they were all negative, so far so good. And Health is expecting, normally when you do genomic sequencing, Chris, it takes somewhere between about 24 and 48 hours to get the results of that. So the actual mapping of that is not an easy task for the pathology people. But in terms of being fussed, I agree with you. I'm not the slightest fussed, because New South Wales has handled this, kept our borders open. I think last month, of all the jobs that were created in Australia, New South Wales created more than half. So every other state and territory combined didn't match the number of jobs that we have created in this state. But we've done it by getting the balance right between our health issues, making sure we take advice from Dr. Chant, our public health officer, and her team, but also looking at the economy issues, because...
But Mark McGowan, then, so Mark McGowan's already being panicky about this outbreak in the West.
Yeah, well, I'm not going to be rude about Martin, but I'll just say to him and to his team that he's got to get real. We're in a 1 in 100 year pandemic. We have more than 150,000 people dead already in America, hundreds of thousands, in fact millions of people between Europe and America who've got the disease, and we are flying Australians back in from those places. And of course, New South Wales has taken more than half of all of the people coming back into Australia. We are bringing them back into our hotels. We're doing it for the whole country. That's what we're doing. I know 10% of all the ones that we've actually brought back are actually Queensland residents, for example. So they do their quarantine, we make sure they're looked after. If they are sick, we get them better, and then we send them back to Queensland. So I think we have handled it, we know how to handle it, and I think Mr McGowan and his team over there just need to be a bit reflective on that. I'm hoping that what he's saying is not being driven by the election on, I think, the 31st of March over there. I'm hoping that's not what's driving it, and I think he also should be thinking about the fact that all this is about balancing risk, but it's also about balancing people's lives. And there are many people who've spoken to me here in New South Wales, and people from his own state, who have said they want to be able to travel back and forth so they can look after their family members. They've got Christmas 2.5 weeks away. So I'd say to the WA government, don't be presumptive, don't be preemptive, be very cautious, because New South Wales, of all the states and territories, both Victoria and New South Wales have been tested, and I think you can say safely that New South Wales has the gold standard, and we're quite confident that we will manage the situation extremely well. Would WA manage it as well if they had the similar situations? I don't know. But
let's hope we don't have to find out. Thanks very much. Wise words indeed.
Thank you.
Thanks, Brad.